Just the landscape of South Africa. I think we live in a multi-tiered economic landscape in South Africa, where you'd find within one city the very affluent to the very disadvantaged. We have got less than 50% of the world average mean annual rainfall. So we're very semi-arid. There's water stresses in the areas, and you may find that you can have high-rise buildings, formal and informal settlements next to each other, literally separated by a main road. We have got a high Gini coefficient where inequality, poverty, and unemployment are continuously on the rise. And therefore, we have got threats around water stress and availability, climate variability, energy supply, which I think everybody now in the world knows about, because it's now become even a bigger issue. There's high increase in urbanization, mushrooming of informal settlements, as well as affordability and costs of services. It's continuously going up. But that being said, we also ask the question, where are the people's priorities? Because everybody has got a smartphone, but most people would not be able to pay for water and sanitation. And of course, there's always the indigent and the very destitute that must be taken care of. But the picture doesn't tell the same story when you look at it. Our challenges of the value chain is that we have got both on-site sanitation, where you have got your flush toilets in the homes. You've got on-site sanitation, where you've got also VIPs or dry sanitation, as we call it. But there's also areas that are not being serviced in terms of sanitation. And if you look at the percentages on your left hand, in terms of a containment, you see that in the cities, mainly in urban areas, there is proper sanitation, but the infrastructure itself, as in what you see on the underground, is really aging, it's overloaded, and how then do we deal with those issues? In terms of the emptying of our sanitation, we do have got some on-site sanitation systems are not emptied. So where you're having dry sanitation, we're actually having the buildup of fecal sludge. And what do we do around that? But you move right across the value chain, and then you will see that about 26%, in fact, of our local municipalities, because that's where water and sanitation is provided, do not even have got monitoring systems, and they do not record. So you do not really know whether the systems are working or not, but the likelihood is that they're not working, hence the non-reporting. About 49% are also regulated, but really not delivering the promised sanitation. And the quality of the effluent is also poor. And then about 35%, you have got serious sanitation challenges. So from the wastewater treatment works to the non-sewer dry sanitation systems, there's always challenges. But most people will experience the flushing toilet and not even worry about what then happens to the rest of it. The challenges range from budgets and availability of the costs to service our sanitation systems, training and capacity. Most local municipalities that provide the services do not have the right people that are trained for the job. Or we also have got a multi system where you find that the most affluent municipalities will afford the best engineers, but then when you go on to the more poorer municipalities, you don't have the best finances, but in fact the need and demand is in the opposite, because the other one would enjoy infrastructure that is existing, but the other ones, that's where there's a need. We have got poor user acceptance, particularly for our dry sanitation, which is our non-sewered dry systems. And this is not the current technologies that we are moving towards, but this is what's currently been implemented. There's also poor infrastructure management as well as asset management, whether it's dewatering of the sludge and where the sludge would be disposed, whether the wastewater treatment works are effective, though that is a poor infrastructure. And also we have got no fecal sludge disposal capacity. Only about 4% of landfill in the entire country is available for that purpose. But even then, the classification of the sludge, the monitoring, dewatering, drying of the sludge, that's something that is still a big challenge. So we understand from the work that has been done and also from the research that the WRC has done, the whole circular economy approach of making sure that from cradle to grave. There is no waste, there is reuse, there is recycling. We have also developed some sanitation and economy opportunities for South Africa. That's research that has been done. We've looked at different technologies in terms of toilets, and we have seen that some conventional methods are not able to give the desired effects. Therefore, we need to be leapfrogging into the next approach. But the understanding of this circular approach and the different government frameworks and autonomy, that's what creates some of the challenges. In terms of the water supply, it's also other areas have got limited water, other areas have got groundwater, and then you don't have the necessary skills. And then how do you then break those binary paradigm that we are locked in as a country to make sure that we are able to understand the new opportunities, embrace them, and even test and pilot and be able to get into this whole circular economy. Some of the solutions that have been developed at the Water Research Commission in partnerships with funders, universities, Bill and Melinda Gates Foundation, go from development of the guidelines to low-cost approaches that have been tested and piloted and been shown to be successful, as well as different and new recycling and reuse approaches, even to the next generation toilets. But still, we sit here, or we stand here today and say there is little or poor uptake because of the kind of procurement processes that we have in the country, where you would have to have a poor, fair objective, but will not cater for innovation and technology. So we're still stuck in the whole old ways of doing things, even though we know that there is a need to implement new and proposed solutions. I know this is not very visible, but if you focus on the columns, you'd see that these are the different types of technologies that have been tested, and the number of seats that have been looked at on average is about 40. And when you're looking at the orange line, it would show you the total cost over a 5-year period, so of delivering the different technologies, and for about 40 seats. And you can see that your new generation sanitation systems are very comparable price-wise overall, and there's also a price per seat that is comparable as well. But then also over the 5 years, the capex and the opex also seems comparable. But there's still poor uptake, even though we know that with these new sanitation technologies, you'd have savings of water where you are recycling your water, you'd have savings of water, and therefore you'd have cost savings. But our procurement system is fixated in the old way, but also the understanding and the buy-in into this new innovation and technology is proving to be very difficult. But during the recent tests that were done, there was higher acceptance. So people, because the technologies were tested, they were not more of a technology, but they were a solution, and people had higher acceptance of this. But as I have indicated, our procurement processes are still obviously then limiting uptake. So the whole idea, I think, is around ensuring that there is capacity building, and I'm quite intrigued by the fact that there's also presence here amongst us, members of civil society, and I think and advocacy groups. And I think that is where we need to be having the real discussion and the conversations around how do we then make the link to push the demand for these new technologies from the ground up, because our government, our politicians would be available, aware of these kind of technologies, but the discussion is around the cost. It's no longer about the dignified sanitation as a human right, but it's more about what will it cost you and how do we then leap. So from the discussions that were held and the presentations that were given this morning, I think there was a lot of success stories being told, but it's, for me, I think the discussions and the more learnings will be around how to overcome that environment, which is really not enabling, to ensure that there can be a shift to this. So that's my presentation. I hope I saved you time.
Thank you, Jennifer. You passed with distinction. You finished within 13 minutes. Thank you very much. With this high standard, I request Peter Harvey to come. Peter Harvey is Regional Advisor, WASH UNICEF Kathmandu. We welcome Peter Harvey.
Okay, thanks very much. And sure. Okay. Thanks very much. Good afternoon, colleagues, and thanks to CSC for this invitation. As mentioned, I'm with UNICEF's Regional Office for South Asia. I'm based in Kathmandu. This presentation, I will focus a bit broader than just South Asia and look at the whole of the Asian continent. So the data that I've extracted is for Asia as a whole. We're going to talk a little bit about drinking water first and some of the status and challenges around that.